What drew me into medicine in the first place, which I suspect is a motivation for a lot of my colleagues as well, is a desire to make a positive difference to people's lives. Being active in research, and particularly by having the role that I do, leading research, I feel I'm able to reach more people indirectly and make more of a difference to people's lives both now and in the future.
My name's Glen Murray. Joined the police in 1988. Stayed a PC for 25 years and was medically retired just over 4 years ago because of renal failure. I was approached by Dr. Tim Dalton, who's a renal consultant at Canterbury Hospital, and he had asked me if I'd be interested in taking part in a study.
The medication we're trialling in Brent is called roxadustat. The most significant advantage of these new medications is the fact that they are taken in tablet form. There's no requirement for an injection, and that has implications for the patients not having to be injected, but also potential implications for the NHS, because at the moment we have a fairly large infrastructure around the prescription, dispensation, delivery and administration of EPO. These medications are potential game changers, and it's a very exciting time.
We take our vision for granted. I was driving one day and I suddenly realised that number plates looked a bit blur in front of me. My day-to-day work was sitting in front of a computer, my reading glasses weren't working for me, getting in my car, I couldn't see clearly when I was driving. It was a nightmare. It was causing a lot of problems in my life. The research I've been involved in is to do with cataracts in people under the age of 45. Basically, they were looking to see if we could adjust as a younger person to having a varifocal in our eye lens as opposed to just a monofocal lens.
So what happens in this study is that people who are under 45 take part, and they're randomised, so they don't know which lens they're getting. So it's either a standard lens, which is a fixed point, or they're having a multifocal lens.
It was instant. I woke up from the surgery and there was an eye chart at the other end of the room that I was in, and I was kind of like, I can read that eye chart. And it was really surreal, because you don't realise how bad your sight has got until it's been fixed.
Keep your balance. That's it now. Arms, keep looking at the PowerPoint. That's it, much better.
My name's David Stevenson. I'm a physiotherapist and I work in the Haemophilia Centre, looking after adults and children with haemophilia, which is a bleeding disorder which affects their bleeding and clotting. However, most of the symptoms are musculoskeletal, so 80% of their bleeding happens into muscles and joints, and so that's the reason physiotherapy is involved.
When he had the knee damage when he was 3.5, he did physio after that. At first, he couldn't even walk. He couldn't walk for months. Really difficult for him.
All right, good.
One of the aspects of research that Robert did was looking at the gait and the walk and how the bleed changes the walk that he actually has and what pressure that then puts on other joints.
We use 3D motion analysis, so the same technology that they make video, animation and computer games with. We got boys with haemophilia and got them to walk and run in laboratory and compared them to the healthy boys without haemophilia. And we noticed that they walked in a certain way. Part of the reason we think they walked like that was due to weakness in some of their muscles. And so we've now developed this exercise program where we hope to be able to correct those things.
Even if it doesn't benefit my son straight away, I know that it will have some benefit in the future. So I think it's really important that people do take part in these studies. And ever since he was diagnosed, he has had the most amazing support and care from the centre and also from the local hospital.
I would ask everyone to think about taking part in research if they get the opportunity. Every drug that people take, all the pathways that people are on, the way we run health services is all evidence-based because of research we've done. So that if people don't do research, nothing will ever change.
It'd be great to discover, a cure for something, or the one exercise or the one thing that makes a massive difference, and do it all of a sudden really quickly, that sort of golden moment. And sometimes that happens, but most research is a step-by-step process about testing theories, testing questions.
But all those tiny little things that people do add up to make great things in the future. The NHS has done everything it possibly can to make me better. And do you know what? By giving a few blood samples or giving a few urine samples or filling out a few questionnaires, if that's all they're asking of me to give back, I'll do that as many times as I'm asked to do it.
I was going to have the cataract surgery anyway. It wasn't going to make it any harder. It wasn't going to ruin my sight. I was doing it, and if it helped people in the future, it made perfect sense for me to be part of the trial.
I would like to say a huge thank you to all the patients that get involved in research in the Trust, and they really are making a difference. They're making a difference in the local area, but they're also making a difference to the UK as a whole. So thank you.